Hey everyone, welcome back to Marketing Science Lab, the podcast where we blend data, creativity, and today, a hefty dose of healthcare insight to keep you ahead of the curve. I'm Sophie.
And I'm Alex, currently geeking out about a new medical center my university is launching, hopefully this year, hence this episode. Today, we're back with an updated, deeper dive into patient-centered care, or PCC, based on a fascinating new study in the Journal of Services Marketing titled Patient-Centered Care in Practice, Hospital and Online Primary Care Settings.
If you missed our last episode about healthcare, we talked about how patient-centered care can really shake up healthcare experiences, boost satisfaction, and improve subjective well-being. But guess what? We've got more layers to unpack. The authors of this paper used 4 separate surveys, over 1,100 respondents, to rigorously test their findings. That's like multiple Netflix seasons worth of data, folks.
Exactly. Their methodology was no joke. They ran exploratory factor analysis, confirmatory factor analysis, and partial least squares modeling to double-check the reliability of their concepts. If that sounds technical, yes, it is, but rest assured, we're here to break it all down in everyday terms.
And the timing couldn't be more perfect. Alex's university is about to open a medical center specializing in surgical procedures and cancer care. So the question is, how can they embed these patient-centered care principles from day one? Also, how does value co-creation fit into all of this? We'll be weaving that concept in throughout the show.
First up, let's restate the 4 principles the study identifies as crucial for truly patient-centered care. 1. Respecting patients' values, needs, and preferences. 2. Collaborative resources of a multidisciplinary care team. 3. Patients actively collaborating with their own resources. 4. Involving family and friends.
Right, and I love how the paper doesn't just say, be nice to patients. It highlights how real collaboration, both from the clinical side and the patient side, can elevate care to new heights. We start with respect. That's more than just courtesy. It's making patients feel heard, treating them as individuals, and actually incorporating their personal values. If I need a quiet environment to recover, or I prefer a certain approach to pain management, it matters that the medical staff acknowledges and accommodates me, within reason.
True. The study's data, pulled from over 1,000 respondents in both hospital and online primary care, shows that when healthcare professionals listen to patients, it lays the foundation for everything else. Think of it like a first date that goes well. If you're truly attentive, you're more likely to form a meaningful connection. That connection is essential for building trust in a healthcare setting.
And from a value co-creation standpoint, this means the patient isn't just a passive recipient. Instead, they're an active participant whose preferences drive decisions. The value is the holistic care outcome, better emotional well-being, deeper satisfaction, and potentially better clinical results too.
Second, let's talk about Avengers-level teamwork. Coordinated collaborative teams of doctors, nurses, pharmacists, physical therapists, dietitians, you name it. This principle goes beyond Dr. X is nice. It's about the entire system working in sync.
Picture it. You've got your oncology specialist, your nutritionist, maybe a mental health counselor. Instead of each person operating in a silo, they come together, share power, and cross-pollinate expertise. Patients see a united front that truly understands their condition from multiple angles.
Yep, the study found that when hospital staff or online care providers actively coordinate, patients rate their experiences higher. The authors specifically highlight how synergy among care team members fuels better patient engagement. And that's a prime example of value co-creation within an organizational context. Each clinician invests their specialized knowledge, and the patient benefits from a cohesive care plan.
For the new medical center at your university, Alex, that might mean building internal processes so all relevant departments share patient data seamlessly. Both the boring vitals like blood pressure and the more intangible notes like patient is anxious about side effects. Everyone on the team sees the same story. Now this is one of my favorites. We often think of the doctor as all-knowing, but let's face it, patients are experts in their own bodies and day-to-day lives. They can bring personal research, track their symptoms or diets, and share real-time feedback.
Exactly. The authors use partial least squares modeling to show how patient activation, or letting patients bring in their own resources like app-based vitals, tracking, or even old-fashioned notebooks, positively correlates with both satisfaction and well-being. It's a bit like a co-pilot arrangement. Your doctor flies the plane, but you're navigating with additional info from the ground.
And that leads to a sense of competence. If you're wearing a smartwatch that tracks your heart rate, you can share that data with your cardiologist. Instead of being a bystander, you're now an active partner. Value co-creation in action, folks. Your personal data merges with professional expertise to produce a more precise treatment path.
The study also emphasizes that this collaboration is crucial in online primary care. If you're only seeing your physician via video or even voice-only calls, your personal record-keeping and symptom reports can bridge the gap. But we'll get to the key difference between video and voice in a moment. Finally, we come to the social side of care, making sure a patient's family or friends can contribute. The authors found that emotional and practical support from loved ones not only improve subjective well-being, but can also boost satisfaction levels in a hospital environment.
However, they discovered a wrinkle in online care. Family involvement often skyrockets the patient's well-being, but doesn't always translate to a higher service satisfaction rating unless the care was delivered via video rather than a voice call. This is a new layer the authors uncovered through multi-group analysis in their data. No video? The support system might be there, but it doesn't necessarily affect how patients rate the service encounter itself.
That's super interesting, right? It highlights the importance of being able to see each other. If the nurse, doctor, patient, and a family member are all in a Zoom session, you get better emotional resonance. If it's just a phone call, you lose those visual cues that often make people feel more comfortable and involved.
So for the new medical center, it's not just about building swanky waiting rooms. Maybe they should invest in robust telehealth platforms that enable group video calls. It's not a small detail. It's a make-or-break feature if you want to fully harness family support.
Let's pause to emphasize an important nuance the study brings up. Subjective well-being differs from service satisfaction. Well-being goes deeper, how you feel about your life, your emotional state, your sense of control, while satisfaction is more an immediate evaluation of the service experience.
Exactly. The authors note that you can have high satisfaction, yes, my hospital bed was comfy, the staff was kind, but still struggle with overall well-being if you're in pain or dealing with a serious condition. Conversely, you might have decent well-being at home if you're stable in your condition, but online service might not wow you, so your satisfaction rating is just meh.
From a marketing perspective or a healthcare management perspective, that's huge. You can improve your service satisfaction relatively quickly through better training and streamlined processes. But well-being is more complex. It involves patients' personal coping skills, emotional support systems, and the severity of their illness.
Exactly. This means hospital leaders need a two-pronged approach. Refine the service interactions to keep satisfaction high, while also offering holistic support, like mental health resources or family involvement, to nurture deeper well-being. Now let's talk about how rigorous this study was. They didn't just survey one hospital, they collected data from 4 different samples, over 1,100 respondents, including actual in-hospital patients and individuals who used online primary care. Then they used advanced statistical methods like partial least squares (PLS) to confirm the strength of these relationships.
Which means these findings aren't some random guess. They're built on layers of analysis, like your typical Netflix docuseries that digs deeper every episode. Each new sample validated the 4 key pillars: 1, respect; 2, multidisciplinary team; 3, patient collaboration; 4, family/friend involvement.
Plus, PLS helps parse out which factors matter most in driving satisfaction versus well-being. So this is real science, folks, not just a single focus group of 20 people in an urban hospital.
So we keep saying value co-creation, but let's define it clearly for our new listeners. In marketing and service research, value co-creation is the idea that value arises through collaborative interactions among stakeholders like doctors, patients, families, and even the staff behind hospital operations.
Right. It's not just the hospital does something, the patient receives it. Instead, the patient's own knowledge, data, and emotional context mix with the hospital's resources, like medical expertise and technology, to create an outcome that's better tailored. That synergy is at the heart of patient-centered care.
Precisely. This concept is especially relevant for the new medical center. You want to design your entire system so that every stakeholder, patients, families, clinicians, admins, can seamlessly share resources and insights. That's how you get not just good care, but truly patient-centered care.
Let's get into actionable insights for any healthcare manager or marketing manager listening. Train staff in listening and empathy. Encourage empathy labs or role-play sessions. The study shows that feeling heard underpins everything else. Build multidisciplinary huddles. Make it standard practice for doctors, nurses, and specialists to align on patient updates daily. Facilitate patient activation. Provide user-friendly apps or even low-tech options like paper diaries so patients can track and share data easily. Family-friendly policies. Let family or close friends join medical discussions. Offer Zoom or in-person family consults, especially for serious conditions. Optimize telehealth. Choose platforms that enable video. Voice only can limit the sense of connection and hamper the family's effect on satisfaction. Address both satisfaction and well-being. Satisfaction can often be improved quickly through better service design. Well-being demands a more holistic approach, including emotional support, mental health services, and robust family involvement.
And let me add a 7. Incentivize team collaboration. This might mean rethinking performance reviews or compensation structures so that staff cooperation is valued just as much as individual success.
The authors also mention the potential for real-time or longitudinal studies, like using mobile apps to track patient well-being day by day, or wearable tech to feed data directly to providers. That's the next frontier of value co-creation. Imagine the patient's daily steps, sleep patterns, and pain levels all integrated so the care team can adjust treatment on the fly.
For your medical center, maybe create a digital ecosystem from the jump. Instead of old-school methods of paper signings, integrate everything from admission to discharge electronically. This future-forward approach ensures that the multidisciplinary team sees updates live, family can chime in online, and the patient's own data is automatically recorded,
which, again, can transform the entire patient experience from a passive lie there and wait to an active track your own progress, share it, let us adapt your care plan together.
So there you have it, a deeper, souped-up conversation about patient-centered care, including details about the methodology, the difference between satisfaction and well-being, and the crucial role of value co-creation.
Whether you're designing a new medical center or looking to improve an existing practice, these 4 pillars can guide your strategy. And keep in mind, invest in the right telehealth infrastructure, empower patients, and train your multidisciplinary team to see themselves as part of one big puzzle.
If you remember nothing else, recall that involving patients, families, and the entire care squad fosters not just better scores on a satisfaction survey, but real positive impacts on a patient's quality of life.
Thanks for joining us. Keep those ears open for patients' voices, bring families into the mix, and watch your care outcomes flourish. Until then, from both of us at Marketing Science Lab Podcast, go make healthcare more human, one conversation at a time.